Welcome to the Rehabilitation and Mobility Service at NC State's Veterinary Teaching Hospital. Today's presentation will give you a look at what we do by featuring some of our recent patients. This is Elvis. Elvis initially came to us unable to walk or stand on his own after suffering from intervertebral disc herniation, commonly called a slip disc, in his back. Most of our patients come to us after experiencing some kind of surgery, injury, or chronic pain. A slip disc can occur for a number of reasons and causes pinching of the spinal cord that is painful and can lead to paralysis. Surgery was required to relieve the pressure of Elvis's spinal cord caused by the disc herniation. Elvis had a surgery called a hemilaminectomy, which is one of the most common surgeries performed by the neurologists here at the Veterinary Teaching Hospital. Initially, it was unclear whether Elvis would ever be able to walk again. But with aggressive and persistent rehabilitation, he eventually regained control of his legs. As you can see, over the course of his therapy, Elvis made gradual but significant improvement in his ability to use his back legs. Elvis is able to take walks with his owner just like any other dog. Of course, rehabilitation takes time. Elvis was in therapy for nearly 2 months. Rehabilitation therapy for pets is equivalent to physical therapy for humans. We treat a variety of species for all kinds of conditions. These could include broken legs, soft tissue injuries, nerve or spinal cord injury, chronic arthritis, or degenerative diseases. Goose is another patient we saw after spinal cord injury. However, his injury was in his neck. His surgery was called a dorsal laminectomy. Patients often have a particularly difficult time recovering from dorsal laminectomy and usually require a great deal of care after surgery. Many are unable to walk for weeks, which can be particularly challenging for larger breed dogs. Quite often, rehabilitation therapy plays an important role in preventing loss of strength and flexibility in animals who are injured and unable to walk. Muscles and joints that are not used regularly tend to stiffen up and decrease in size. As patients who are unable to walk are recovering from their injuries, rehabilitation can help keep the muscles strong and joints healthy to minimize the long-term effects of their injury. Pain management is a large part of what we do. We have a variety of tools to help with pain control in addition to the medications that are traditionally prescribed by the surgeon or primary care veterinarian. Options for pain management include heat, massage therapy, low-level laser, electrical stimulation, acupuncture, and therapeutic ultrasound. Each of these tools or modalities has a unique mechanism of action and purpose. Some of the modalities have overlapping benefits, which is helpful in cases where the patient doesn't tolerate or isn't a candidate for a particular treatment. Older dogs often have a harder time recovering from surgery or illness simply because they are more likely to have other factors that interfere with their recovery. The majority of our patients on the rehabilitation service are middle-aged or older, and most have arthritis, previous injuries, reduced muscle mass from declining activity, or some other condition that makes it more difficult for them to heal and return to normal activity. Disco is a 14-year-old female who came to rehab after dislocating her hip. An underlying cause of her dislocation was weakness in the muscles that normally help hold the hip in place. Low-impact, controlled, therapeutic exercises targeting the hips and rear legs were an important part of Disco's therapy program. This is Gus, a very large patient with a combination of orthopedic and neurologic problems. In this photo, Gus is receiving acupuncture to manage his pain and promote nerve signaling. Gus came to us after surgery for a slip disc in his neck. The name of this surgery is a ventral slot. He was also overweight and had severe arthritis in several joints, which complicated his recovery. Supporting, improving, or restoring a patient's ability to walk is the primary focus for the rehabilitation team. Ultimately, our goal is to send our patients home walking. When this is not possible, we help make them as independent as possible so that they can participate in normal daily activities. Unfortunately, like the human population, a growing segment of today's pet population is overweight. The rehabilitation service is an important part of the team approach to weight management here in the Health and Wellness Center. The benefits of rehabilitation therapy are not limited to dogs. This is Stretch, a cat who came to rehabilitation for exercise therapy to help manage his severe obesity. As you might imagine, cats present unique challenges to the rehabilitation therapy team. In particular, keeping Stretch motivated was sometimes difficult. Sometimes it is as simple as using his own inclinations to our advantage. In this case, food and a desire to get back to bed after his workout. Thanks to advances in nutrition, medical science, and preventative care, many pets are living longer lives, just like their owners. Because of this, care of the geriatric pet is gaining attention. As with aging seniors, consistent daily activity is an important part of staying healthy, managing joint pain, and managing weight. Thank you for joining us today. We hope you've enjoyed this peek into the Rehabilitation and Mobility Service. We will be here for a few more minutes and happy to answer any questions you have. Enjoy the rest of your visit to the College of Veterinary Medicine.